Today, you and I are going to share 3 research articles, some of them compendiums, some direct studies, in reference to female health challenges that somehow went under the radar. The first one is in regard to potential or exploratory treatments nutritionally with endometriosis. The second one, polycystic ovary syndrome. Very few treatments out there, but they may have found one. And third, in regard to postmenopausal females, in reference to beets or beetroot juice, about 40 milligrams of nitrates per 70 milliliters, helping with endothelial function in regard to help alleviating potentially heart disease. Now, again, many of these are pilot studies. They are exploratory, but as we delve into the information briefly, you're going to see why they're so important. So let us proceed as follows. The role of selected dietary factors in developing the course of endometriosis. Here's some gold. Quercetin. In a study of 33 women with clinical diagnosis of endometriosis, they observed a marked reduction of pain in patients as well as the use of much lower amounts of non-steroidal anti-inflammatory drugs resulting from a supplementation of 200 milligrams of quercetin, 210 milligrams of dry turmeric extract, and 150 milligrams of acetylcysteine over a 2-month period of time. In doing so, no significant side effects were reported. Again, I want to emphasize exploratory as we're looking at pilot studies. Next, resveratrol. This one's kind of amazing. I'm surprised it didn't get more attention. To proceed, they evaluated the efficacy of resveratrol in treating pelvic pain and painful menstruation among 12 women, again, pilot study, with endometriosis, adding 30 milligrams of resveratrol for 2 months to oral hormonal contraception resulted in complete resolution of pain in more than 80% of patients. Number 3, couldn't find the dosages, but you'll get the gist. To proceed, polyphenols. The use of a composition containing, among other things, curcumin, quercetin, in 30-person group study was associated with significant reduction of adverse symptoms associated with endometriosis, including headaches, pelvic pain, and abnormal menstrual bleeding. 3 very powerful pilot studies which show incredible amount of promise. Now to follow up, we're going to look at polycystic ovary syndrome, PCOS. So few treatments out there, but from the plant Artemisia, or I should say Artemisia, it could be from a variety of plants, wormwood, mugwort, and a few others, is through a process of reduction to produce dihydroartemisinin, they were able to discover something quite interesting. Now, going to clinicaltrials.org, I found out the dosage on this was about 40 milligrams of dihydroartemisinin, if I get the pronunciation correct today, basically over a 12 consecutive weeks. And this is what they discovered. The artemisinin derivatives isolated from the Artemisia plants. In a pilot clinical study, 19 women with PCOS further demonstrated that the therapeutic potential of artemisinin for these women taking dihydroartemisinin, a drug used to treat malaria, for 12 weeks substantially reduced key PCOS biomarkers and led to more regular menstrual cycles without side effects. Not a lot of information on this particular human trial. You could find it on clinicaltrials.gov, but this basically is a helpful tool from the Artemisia plants. And when they say semi-synthetic, they're talking about taking the Artemisia and going through a process reduction, just to reiterate. Should say semi-synthetic version. Pretty amazing, but a lot of hope. And again, right before us. And then, to follow up and to conclude, let's look at, does a beet a day keep heart disease away? After women go through menopause, the risk of heart disease increases dramatically. I want you to keep in mind, this was only a 7-day trial. One group took beetroot juice with nitrates. The other one had a beetroot juice with nitrates removed. But to proceed, after women go through menopause, the risk of heart disease increases dramatically. To improve and support heart and blood vessel health among postmenopausal women, here we go. After menopause, women no longer produce estrogen. I am quoting, again, there's different types of estrogen, so on and so forth. I'm just quoting, which helps maintain nitric oxide in the body. So that's a real important statement right there. Basically, as we proceed, the loss of nitric oxide production contributes to the substantial increase in heart disease risk for postmenopausal women. Foods that are rich in nitrate, especially beets, are being investigated as a natural non-pharmaceutical way to protect the heart and blood vessels. In this study, participants had their vascular function tested, and then they consumed a 2.3 ounce bottle of beetroot juice as an initial dose. So the first day they drank 2, then 1 bottle every morning for a week. Again, only 7 days study. All participants consumed concentrated beetroot juice, with each serving providing as much nitrate as 3 large beets. Again, about 40 milligrams of nitrate per 70 milliliters. A few weeks later, the participants drank beetroot juice with nitrate removed. Crossover study. To conclude, we'll look at the full study because it explains it better. We demonstrated, quoting, that 7-day nitrate-rich beetroot juice supplementation improved endothelial function to a clinically significant level in postmenopausal women, with no difference between early and late menopause. This finding is of particular importance given the prior evidence and timing hypothesis that suggests pharmaceutical interventions are less effective at reversing endothelial dysfunction in women beyond 6 years since menopause. So what we'll do here is I'll have the DOI citation. These are the links to the full study for you. So full studies of each one. So you can delve into a lot more on your own. Again, a lot of them are pilot studies or experimental studies, but they're done in people, which gives it a huge plus as opposed to just an animal study. But again, incredible research, just kind of went under the radar. Not enough information to do a full report on any one altogether, but it is still, nonetheless, highly valuable information that I enjoy sharing with you. Again, gratitude to the researchers. I am humbled you watch. I hope I didn't speak too fast. And I look forward to seeing what you and I share next week. Catch you all next time. And this is our new studio, so a little bit of an echo. We'll get it together. Catch you next time. Bye.